and welcome. Thank you for being here today. I'd like to start out with a question. Have you ever had a hard time breathing? Well, have you ever run a race and couldn't catch your breath at the end? Well, how about we try another example? What if you have a straw, about the size of a coffee straw, you put it in your mouth and you breathe through it, not through your nose? Was it hard? It was for me, and it was only one breath. Have you panicked yet? I would have. And that's where I come in. My name is Holly Stine. I'm a registered respiratory therapist, and I help children and adults of all ages to breathe easier. So a very common question I get is, what is a respiratory therapist? And rightfully so, because few people have ever heard of them. Well, a respiratory therapist, in short, is a very important part of the medical team. We work under the supervision of a medical director and alongside nurses to help care for our patients. We go through at least 2, but sometimes 4 years of schooling. And after we graduate, we still have many years of continuing education. Our education never really ends. We also have basic life support that we certify in, and we have to maintain those certifications every 2 years. And then some of us choose to go on to certify in cardiac, pediatric, and neonatal advanced life support. So just a little history. Respiratory therapist dates back to 1943, although some argue a little bit earlier than that. But it was the physician by the name of Dr. Edwin Levine who began to train technicians in the post-surgical management in Chicago. From there, therapists grew to involve the inhalation of oxygen and medication, and then eventually coined the term inhalation therapist. In 1947, the Inhalation Therapist Association, or ITA, was formed. And later, in 1973, that would become the American Association of Respiratory Care. In 1957, schools opened to start the advanced training of these technicians, which now included breathing machines. In 1969, inhalation therapists now could apply for credentials or sit for the registry exam. Inhalation therapists became known as respiratory therapists in 1970. So that's what we are. Now what do we do? Well, if you come into the emergency department and you're having trouble breathing, they'll calm you down and I'll give you a breathing treatment. Now this could be in the form of a nebulizer or a puffer inhaler. Children like to call them puffers. If you can't cough secretions out, well, then we can do a number of therapies, including patting on your chest or positioning to help you cough them up, and that's called chest physiotherapy, or CPT. One of the not so glamorous parts of my job is if you can't cough those secretions up and they're impairing your ability to breathe, well, then we put a little tube kind of down your nose and into your lungs. Doesn't feel very good. But anyway, we put that down there so that we can pull those secretions out of your lungs to help you breathe better. We also can teach you a number of coughing techniques and breathing techniques to help keep your lungs open so you don't get a pneumonia. And God forbid if you stop breathing, we can put a breathing tube down into your windpipe, or trachea as some call it, so that we can breathe for you until we can get you on a form of life support system. We manage the ventilators, which are the life support that many people see in movies like, in TV shows like Grey's Anatomy, that respirator, it's called a ventilator. And we can also draw blood from your arteries to help see how your body is moving the CO2 and oxygen from your lungs into your cardiac system. And that helps us to manage your life support. Now here's a different scenario. Imagine you are getting ready to have a baby. Arguably one of the most exciting times in your life, depending on who you are, of course. Now imagine that you're only about halfway through, maybe 23, 24, 25 weeks of that full 40 weeks. That's very premature for a baby to come out. Well, who's in your delivery room? You have your physician, maybe 2 physicians, one for you, one for the baby. You have a nurse practitioner. You have a team of nurses, some for you, some for the baby. And then you guessed it, you're going to have a respiratory therapist in your room as well, and we're there to manage your baby's breathing and airway. Also, we can give life-saving surfactant, which is a substance that all human bodies produce. The little babies, their bodies are too small to produce it, so we can give an artificial surfactant to help keep their airways open and help them to breathe easier. So another aspect is we are an integral part of the transport team. We are professionally trained to stabilize and support babies, infants, and children on life support, well, on and off life support, for transport. Transport therapists work alongside registered nurses and emergency medical technicians, EMTs, to ride in the ambulance, fixed wings, and the emergency medical helicopters to assist with the safe move of infants and children from outside hospitals to medical centers. And finally, another aspect that very few people have heard of is called ECMO. Respiratory therapists with 2 years of experience can train for it and sit ECMO. And ECMO stands for extracorporeal membrane oxygenation. And what this is another way that we can bypass the heart and lungs to keep the body open while those heart and lungs heal. This is a big responsibility, and few choose to undertake it. There's 2 weeks of intense classroom training, followed by 40 hours, plus, if you want to have more time, of precepted patient care setting training. Many of these therapists can and do, after 2 years of formal training, go on to become perfusionists. And those are the people who sit the bypass machines during open heart surgeries. So, to quote a fellow respiratory therapist, to breathe or not to breathe, that is the essential question of life. If you have never heard of a respiratory therapist, fantastic. It means you have never needed one. But if you have heard of us, always know that we are there to help you. There is a standing joke among RTs in my field that we are the last one anybody wants around, but we are the first one anybody calls if there's an emergency. So hug your respiratory therapist. You never know when you might need one. Thank you for your time.